Joining us for some reaction is Dr Mvuyisi Mzukwa, who is the chairperson of the South African Medical Association. Dr Mzukwa, thank you for making time for us. What do you think, as summer, of the appointment of Professor Taole Mokoena as the new health ombud?
Good afternoon to you, Clement, and to your viewers, and thanks for having me. The South African Medical Association obviously welcomes the appointment of Professor Mokoena, and we don't really look at personalities, but we do look at the will and also the independence of that person, to be able to execute the duties, before him. We know that, he's taking over from Prof. Makgoba, who is very independent in terms of his thinking and also does not really sing for his supper. So we hope that Prof. Taole would take over and also speak the truth to power, like Professor Makgoba was doing, and make sure that there is implementation of, whatever interventions that have been identified. We believe that he's a very seasoned man, a clinician and also an academic. So we believe that if he's given a chance, he can do his work. But also it depends on him that he distances himself, from these connections that might be there. He's got a lot to prove. That is not really singing for his supper, to those who are appointed.
Professor Makgoba, in his last address, painted a dire picture of the state of healthcare in the country. In fact, during his term, we saw an increase in the total number of complaints, which is not really surprising if you look at the quality of health delivery in our public hospitals. That's really been deteriorating. Where do you think this new health ombuds should focus on as priorities?
Well, I do think that, like Professor Makgoba was saying, that the system really needs an overhaul. But it does need to see, what areas were identified and prioritized by Professor Makgoba. For example, the issue that was raised sharply by Professor Makgoba was the issue of incompetent CEOs who are running our institutions, the area of leadership and governance. I think that's the area that we do need to focus on, making sure that we can deliver, because you can't deliver, with people who are not well versed with the work that they're supposed to do. But on top of that, we do need to make sure that we enough resources, like you said, equitable distribution of resources, across the country in terms of rural versus the urban areas, but also the peri-urban areas, private versus the public sector. This is very important, as we go towards a reform in the country.
Given the current quality of healthcare, you can't help but wonder if hospitals will meet the high standards that are required by the National Health Insurance. Many of our facilities have honestly been failing the norms and standards that health institutions need to comply with before the NHI is implemented. So how ready do you even think our facilities are for NHI? That's one thing Professor Makgoba has been warning about.
Well, our institutions, as you know, according to his office and also the Office of the Health Standards Compliance, we're really not ready. The last time I checked, the report said there's only 20% of them that are ready for accreditation. So you can imagine going forward that there's a lot of work to be done. Our hospitals are falling apart, dilapidating, and with problems with sanitation. And this is compounded by the electricity shortages that we are facing as the country. But on top of that, there is a dire shortage of healthcare workers, doctors and nurses in the country. You cannot have a quality service without having enough numbers of doctors and nurses to execute, their duties on the ground.
Yeah. Do these health ombudsmen, from what your experience, Dr. Mzukwa, do they have the support of government? I mean, when you look at the reports that the health ombudsman has released over the years, I mean, there was a recent one where he basically confirmed that pregnant patients at Rahima Musa Mother and Child Hospital were forced to sleep on the floor. You already have spoken about issues of leadership problems at Gauteng hospitals and how serious that is. But do they have the support of government? Because some of these problems are beyond their control. They're going to need a government that not only scrutinizes their reports, but also implement their recommendations, and they really sort out what these health ombudsmen point to as the challenges in our health sector.
As you may have noted, from where we are seated, we don't think that they are getting support. Because, if you look at the reports that have been released, have been scathing. But there's nothing much, that has made the Department of Health or, the officials, to make sure that, they implement. I mean, just recently, we've heard that the province, one of the hospitals allowed babies to be kept in card boxes there. And you cannot imagine that it would continue to happen, because already there were issues that were raised with the hospitals like Rahima Musa and many other hospitals in the country. And Professor Makgoba had already said that it's not only Gauteng, and the other provinces are involved as well. And the Eastern Cape then was quoted as being very dysfunctional. So you can imagine then the work that is out there. I don't think, honestly, there is support. If there is support, it's just a political rhetoric that is not showing any fruits.
Yeah. Well, thank you so much for making time. Dr. Mvuyisi Mzukwa is with the South African Medical Association.